So, in this gluteal region, how many gluteal muscles are present? Three gluteal muscles. Gluteal maximus, gluteal medius, and underneath gluteal minimus. So, three gluteal muscles. They come with different function. So, that's the first story. What is the main function of gluteal maximus? Extension in hip. So, in which situations we use gluteal maximus? To stand.
I'm upstairs.
Then, when we stand from sitting position, we use it. And when we climbing stairs, we use it, right? So, all that means extension in hip. For what we use the gluteal maximus. What about medius and minimus? Because they do same muscle. What is the name for the muscles if they do same function? Synergistic muscles, exactly. So medius and minimus, they are synergistic muscles. So what function they do? They are not rotators.
Abduction?
Abduction, exactly. Because if we are looking in hip movements, actually what we expect flexion of the hip, and that comes from anterior group of muscles of the hip, of the side. If we need extension for the hip, we are talking about gluteal maximus and hamstring muscles, right? If we need adduction in hip, we use adductor muscles of the side which belong to medial group, right? But for abduction, we use just these two muscles, medius and minimus. And if function of that two muscles is compromised, so actually that's no abduction in hip. So now let's talk about innervation for that muscles and about situation and sign when we can lose that innervation and muscles will be paralyzed. Okay? So, could you tell me please, which nerves we do have to innervate gluteal muscles? Gluteal nerves, exactly. So we have two of them, superior gluteal, inferior gluteal. So, how to understand where this nerve presents? They are not here on this region, but they come both sides of this muscle. Again, tell me, what's the name of this muscle? Piriformis. So I told you that's our land muscles over here in this region. So superior gluteal nerve runs superior side of piriformis through the suprapiriformis foramen. Inferior gluteal runs together with sciatic through infrapiriformis foramen. Now, which nerve innervates our gluteal maximus? Inferior gluteal nerve. If inferior gluteal nerve is in trouble, your patient will have problems with standing from sitting position, with climbing stairs, generally speaking with extension in hip. Which situation could lead to the injury of inferior gluteal nerve?
I got shot to the butt.
Sorry?
I got shot to the butt.
Shot to the butt, but no, it's very real condition.
Is it if you give the injection, if it's not given in the upper
if
lateral?
it comes together with sciatic, so we can injure this nerve due to improper place of injection. And the same story, posterior hip dislocation, right? And one more story, another traumatic injury or poliomyelitis. Okay, that's it. Inflammatory disease of the bones. So actually that kind of surgical procedure due to that condition may lead to injury of the nerve.
That's just the superior. Inferior, so that's just the inferior.
Inferior gluteal.
Okay.
Yeah, almost same condition like for the sciatic. Now, in superior gluteal nerve, we just mentioned this nerve innervates medius and minimus, gluteal medius and minimus. And we just mentioned that they are responsible for abduction. How to check that this nerve is injured, in trouble? How to check the abduction? You have your patient, you ask him to lift one leg from the floor. he will do that. He is standing with the support probably, it doesn't matter. And usually you're looking on pelvis, and pelvis usually in such condition. So it's on horizontal plane. But in case after lifting the leg, your patient will drop the hip, what it means? That opposite side, medius and minimus, can't keep it straight. Means they are paralyzed and abduction is impossible. Okay? This sign we mean Trendelenburg sign. So Trendelenburg sign means dropping of the hip and opposite side injury of superior gluteal nerve. Opposite side gluteal medius and minimus